Tourette syndrome is a disorder in which people have uncontrollable tics. There are two different types of tics. There are vocal and motor. Motor tics are movements such as blinking your eyes. Vocal tics are repeating a word, so saying something. Within these tics there are subsets such as simple tics and complex tics. Simple tics, for example, as in a motor tic, would be just a quick scratch of the wrist, but a more complex one would be when you blink your eyes, blinking your entire face in and just doing that a couple times. A simple vocal tic, an example of that would be saying something, repeating a word. That would be an example of that. An example of a complex vocal tic would be cursing, saying profanity, repeating that. It's fairly difficult to diagnose Tourette syndrome just because many doctors, it's difficult for them because you have to have these tics for at least a year, because when you're going through your developmental stages, you have tics often and they go away after a couple months or weeks or how long, and that is not Tourette syndrome. Another reason why it's difficult, because like I said, the eye blinking, parents may think it's a vision problem. They may not think of it as Tourette syndrome. So it is very difficult to diagnose. But many people who have it, they develop it in their teenage years, in their young, like 2 to 15 is when they start in there, and they usually grow out of it by their teenage years. It usually gets worse. Most people get away from it, or they may just have it less severe. Those people that have the severe cases, typically there is treatment for it, but only for the very severe cases, and that treatment is things such as medicine and behavioral therapy. The medicine, it works different for everyone, so everybody gets, you have to try stuff out with it. With the behavioral therapy, typically it's training you not to do that. It's not as effective as the medicine, but it is another option. Men are 3 to 4 times actually more likely to get this disease than women are, and it is believed it is to be inherited genetically or through the neurotransmitters, but that is yet to be proven. So there are some research being done right now about this disease. Like I said, on the genetic side, there's been research to see if it is inherited. That is yet to be proven, like I said. And there's also clinical trials to see if ADHD medicine will work with this to cure it. Bottom line is, if you have Tourette syndrome, don't worry. There is treatment for this, for the severe cases, and if it's not that severe, you very well could grow out of it or have it less severe. Thanks for learning about Tourette syndrome.